It's a pleasure for me as Senior Policy Officer with the Institute of Public Health to turn my attentions to rare diseases as a public health priority across Europe and now in Ireland. I'm going to talk to you today about the work of the Research and Information Subgroup, what we've been doing, and the areas that we've been looking at, and to give you a feel for how far we've got in our deliberations. But I would very much stress that we consider this still to be a work in progress. The areas that the Information and Research Subgroup covered related to the recommendations for the development of national plans for rare diseases in Europe developed by Europlan, and covered two areas: the definition of rare diseases, the coding of rare diseases, and the recording of rare diseases within information systems, and secondly, research on rare diseases. But what we realised, of course, is that these areas are mutually reinforcing. When we have high quality data recorded through health information systems or registries, this can facilitate participation and further research in terms of international clinical trials. And similarly, good basic and clinical research is needed so that rare diseases are better identified, defined and understood. The first area we looked at was on information, and the areas we covered related to the definition of a rare disease, coding within health information systems, patient registries, linkages to European and global data, but we were particularly interested in developing a strategic approach to information that would also facilitate the synthesis of data, mobilising the databases that were perhaps under-analysed and using those in a way that could inform policy and practice. Research is a term that, of course, has many meanings, and we looked at the areas on this diagram here across the spectrum of rare disease research, starting with population health and epidemiology, health services research, basic clinical biomedical research and translational research. But we also realised through the processes that we used that there is a need to engage with other research methodologies that can capture both the lived and indeed the end-of-life experience of the rare disease patient. There's particular issues at the patient-doctor interface for patients with rare diseases in terms of the exchange in information and advice. There's particular issues related to long-term caring and relating to disability. So the core subgroup consisted of the steering group members, myself, John McCormick from the Medical Research Charities Group, Catherine Gill from the Health Research Board and Louise Kenny from the Department of Health. But we received very gratefully additional contributions from members of the Rare Disease Task Force. So I'd like to say a particular thank you to Dr. Sally Ann Lynch from the National Centre for Medical Genetics, Avril Kennan from Deborah Ireland, Avril Daly attended a few of our meetings, Anne Lawler, chairperson of 22Q11 support group, and we also liaised with Orphanet, the Cancer Registry on the Rare Care Project, the Northern Ireland Rare Disease Partnership and others. Each of the subgroups was asked to develop a draft report according to a certain template that looked at the strengths and weaknesses of the current situation, looked at European international best practice and developed some very early preliminary recommendations. We held a small seminar on the 26th of March, particularly to look at rare disease research and models that had been used elsewhere. And in terms of the consultation, there's been a lot of informal communications. We had that seminar, there's today's event, but there's also the online questionnaire, and we're hoping that through this combination of processes, we can fill in as many gaps as possible. So this is just a feel for some of the strengths that we identified out there. We do have some very good rare disease registries. We have some very good data now on rare cancers in the National Cancer Registry. The Health Information Bill, potentially. We're a little unclear as to what the implications of that will be, but it would be good to have further legislation to support the development of information on all patients, on all diseases, but particularly on rare diseases, and also Irish membership of European registries. We also identified a few weaknesses. I suppose one of them is in terms of the implications of forthcoming policy and legislation and the absence of a clear reporting system for our national profile of rare diseases. Obviously, there's limitations to the ICD-10 coding system, which is how diseases are coded for in the health services, and a need to develop health information standards for the coding and reporting of rare diseases. And the difficulty here is that when we have an information system that doesn't adequately recognise rare disease patients, they become invisible across a range of domains. In terms of research, we did identify that there was some very engaged patient organisations, some good leader clinicians, academic departments, pharmaceutical and biotech companies, and there's extra benefits from professional groups such as the Irish Society of Human Genetics that meet on an all-island basis and exchange what they're doing, talk about the issues that they face and the research that they're doing, alliances and international groups. The Medical Research Charities Group was identified as quite a successful model, partnering with the HRB to support research on rare diseases, the development of research infrastructure networks, and our linkages again with European areas. But I suppose one of the main difficulties was that there's no central go-to source of information on rare disease research. This is in the interests of everybody, particular researchers that may need a particular laboratory or a particular group of patients or a particular clinician to become involved. No overall strategic approach and no distinct identity to rare disease research, for example, within the Department of Health's Action Plan on Rare Disease Research. So there's a need to come together and give this a real identity. Networking happening relatively ad hoc, good in places others than others, and we felt that the overall level of international collaboration was quite patchy. If you'd like to correct me on that, please come along to the workshop and tell me all about it. But I think one of the main issues was that in terms of the research supports for clinical specialties relevant to rare disease, whether that's in medical genetics or in neurology or other areas, that there is a difficulty with securing dedicated staff time, resources and linkages with career development pathways for clinicians interested in engaging in rare disease research. And that is an issue. It's also an issue that there is a tendency for research on the common rare rather than the rare, and a lack of research on the broader aspects of rare disease, including education, disability, employment, social services and end-of-life care. So the key points for discussion today, I will summarise as this. If you are involved in rare disease research, please tell me about it. We'd like to know. We'd like to know what you believe are the key outcomes we should expect from improved information and research in the National Rare Diseases Plan. We have some building blocks in place. We have some good registries, we have some surveillance, we have some very good research, but it's about building these together to get the right balance and to work collaboratively across sectors and internationally. That's the challenge we face today, and I look forward to discussing it further in the workshop.